by myself and Mayor Scott, these tough restrictions are guided by the metrics, including case count, positivity, hospitalizations, and death, that indicate we continue to experience widespread community transmissions. Our hospitals serve not only Baltimore City residents, but residents across the state. Those hospitals were on a dangerous trajectory to potentially being overwhelmed a few weeks ago, and I remain concerned about our hospitals being overwhelmed today. Keeping high-risk locations closed gives time for hospitalization rates to decrease and to ensure that our hospitals have enough space and staff to deliver high-quality, life-saving care to the patients coming through their doors. We will continue to monitor key reopening metrics and will report out our findings regularly. All of this information is publicly available and can be found at coronavirus.baltimorecity.gov. I would also like to take a moment to update residents regarding Baltimore City Health Department's efforts to distribute the COVID-19 vaccine. Due to limited initial supplies, the Health Department has worked very closely with the Maryland Department of Health and other health departments across the state to develop priority groups to ensure near consistent prioritization across the state. In Baltimore City, we took into account specific population factors and priorities to tailor that sub-prioritization to meet the needs of residents here in the city. Today, I am pleased to report that in addition to the thousands of vaccines distributed by hospital systems to their employees and the vaccines distributed to residents of senior and assisted living facilities by CVS and Walgreens, the Health Department has provided 842 vaccines to EMS, fire, police, health department employees, as well as urgent care, dialysis workers, and frontline judiciary staff as of yesterday, in our first 3 days of vaccination at Under Armour's Port Covington campus. We remain grateful to Under Armour for their partnership in securing a safe location to distribute vaccinations for city employees and healthcare workers. We also appreciate the support of our clinical partner volunteers from Maryland Responds and Coppin State University. In accordance with MDH guideline, beginning on Monday, January 11th, all members of Priority Group A, including all non-hospital-based licensed, registered, and certified healthcare providers or individuals who work in Baltimore City healthcare settings or who live or work in Baltimore City will be able to sign up for appointments by visiting our website, coronavirus.baltimorecity.gov/COVAX. That's COVAX. Baltimore City is home to a number of healthcare professionals, both hospital and non-hospital affiliated. So our priority group 1A may be larger than other jurisdictions. Nonetheless, our clinical staff is confident in our ability to scale up our vaccination operations to serve our priority group 1A populations. Again, definitions of who are in priority group 1A can be found at coronavirus.baltimorecity.gov/COVAX, COVAX. Earlier this week, I told you all that the vaccine is here. It's no longer a possibility, but it is a reality. I've committed to being transparent during all phases of our vaccine rollout, and to that end, our clinical teams have been working through and troubleshooting technical and logistical challenges as they've written, including a number of last-minute appointment cancellations and no-shows. We're working closely with our state partners to troubleshoot these issues, but early reports suggest that a number of Baltimore residents and Marylanders from other jurisdictions not in Priority Group 1A sought to get a vaccine early. All those seeking COVID-19 vaccinations during Priority Group 1A must show identification and documentation proving they are residents of or work in Baltimore City and are Priority Group 1A members before they are admitted into the vaccination site. Due to this scrutiny, we remain confident in our ability to prioritize vaccines for those identified groups, but remain concerned about abuses in the system. If you're not a Priority Group 1A member, please do not attempt to sign up for a vaccine at this time. If individuals show up who are not part of that priority group, they're taking away appointment slots from those individuals in Priority Group 1A. In the coming weeks, we will be updating our dashboard to include information about the number of vaccines distributed. In the meantime, we ask for your patience and your honesty as we are working through vaccinating Priority Group 1A, so that when we move to later phases, we have built a base of healthcare workers and first-line responders who can assist us in vaccinating the general public. In the meantime, please continue to wash your hands, maintain social distancing, and wear a mask in public to reduce the chances of disease transmission. Thank you.
Thank you, Dr. DeRaza. We have not seen the full impact of the holiday yet, so we don't want to reopen too soon. I understand this is frustrating for our restaurateurs and their employees, but as always, our decisions in Baltimore are made with the health and safety of our residents in mind, and we will continue to be guided by the science and the advice of our public health professionals. I ask our restaurants, business owners, and residents alike to have faith, patience, and continue to trust in the process from our public health professionals as we continue to navigate this pandemic together. And with that, we'll take a few questions. Go ahead.
Mayor Scott, how are you?
How are you?
Thank you. Some of the economists that we've spoke to about the future of the city regarding, some of the closures that we've seen of these major restaurants, it seems like a bleak outlook. Who on your team have you been talking to about how we get past this when we move to the future and things do open up?
Listen, so first thing, again, the first thing and most important thing here, right? Lives are more important than money. We have to understand that. Our economic team, our folks in the city, VDC, we're all going to be working to support as we have. I know we've said this to you now probably 30 times. The millions of dollars that we've put out, we're going to be working with our congressional and our state delegation as we now have a new round of money, and we'll be working to get that out to people. And this is something that we understand, right? We know this is tough. We know this is hard. But we also know that people are dying. And that's the most important thing that we have to understand. And we're going to be there to support our businesses. We're going to be there to do whatever we can do to make sure that they remain strong and make it through this. Together we will do that, but we will not put money over people. Next question.
Mayor, this deals with the issues dealing with crime in the first
Yes, sir.
part of the year, and also with last year. One of the things you talked about and also the police commission dealing with domestic violence, and this was also an issue last year as well. Have you come up with any new initiatives and things that you're going to do, like right now, or what are you trying to do dealing with that?
So, I never want to give out too much detail about how we're going to be actually doing public safety initiatives, but I think it's important, and Barry, to remind yourself of this, that we're 1 month in, right? And when you're talking about a city that has never had a comprehensive approach to dealing with violence in the city, that has never had an office dedicated to dealing with neighborhood safety in the city, these are the things that we're going to be built. This is why we're assembling this team, so that we can attack all of these issues in a different way. We have our partnerships in our office that we deal with folks who help with intimate partner violence. We're going to be working with them to expand their work, but also to expand our reach into neighborhoods themselves. Ava Joy?
Hi, Mayor. So this doesn't have to do, I know this is outside of you guys' jurisdiction in Baltimore County, but it has to do with your constituents. The assistant principal at Dunbar High School who was killed, we're now hearing that an arrest has been made. Can you just comment on that? Because we know many people in Baltimore City were hurting about that.
Well, we're all hurting. We're talking about a young man who dedicated himself to making sure that young women and men in Baltimore City could reach their fullest potential. And to have someone who has breathed life and hope and lit a fire into so many young people just have their life just taken out like that, it hurts. When you know young people that went to Dunbar or any other schools that he worked at, and you can see online the outpouring of students saying how much he meant to them, the whole city hurts when something like that happens, even though it didn't happen here in Baltimore. And we just pray for his family, pray for the entire school system in Dunbar in particular as they deal with this tragic situation, and hope that justice is brought to bear. Next question. Dan, let her go.
Absolutely.
They haven't asked a question yet.
Recently, the governor suggested sending in the National Guard to assist with your vaccination efforts. Have you spoken to him about that prospect, and is he going to make good on that promise?
No, we have not. We learned about that the same way you did when the press conference happened. What we will do, and I know that Dr. Zaraza will talk a little more about that, we will work with our state partners and continue to work with them as we navigate this process. We know that there are issues. Dr. Zaraza talked about the scheduling issues, which is a state system. I will remind everyone, and she's been communicating. I know the other counties have been communicating that with the state as well. It's about making sure that we get the vaccine out to people. That's the only thing that matters. We're going to work with our state partners. We're going to work with other partners to make sure that we do that. Dave? Are you good? I saw you today. There's no speaker. Dan, last question.
Last question. I just had a question about the Ravens, if they have reached out to the city at all about using M&T Bank Stadium as a vaccination center, and if that would be something that the city would be willing to help expand the services here.
So, Dan, actually, I'm glad you said that. No, I personally will be reaching out to both the Ravens and the Orioles about that myself. And since this is the last question, go Ravens. Thank you, everybody.